Welcome back. So now that you've watched that little video, I wanted to jump into the main content for this week. So starting with adolescent pregnancy. So the first thing is that here in the United States, we do have a high rate of adolescent pregnancy versus other developed countries. And there's a couple possible reasons for this. So one of those reasons is that childbearing is regarded as an adult activity more in other nations than necessarily the US is. So in other countries, it's seen as something that adults do versus in the United States, there's maybe more of a tradition or it's maybe not as abnormal for teens to maybe marry and have children as it is in other countries. So just that macro system is a little different here. So also in that same vein, there are clear messages about sexual behavior in other countries, or maybe clearer messages saying that sex is normal, it's something that adolescents do. Because the thing is, adolescents in the US versus other countries aren't really, neither the US nor the other countries is really having more sex than the other. So with that, it's more of that cultural context and that macro system that allows this more open discussion of sexual behaviors and sexual issues, allowing for easier access to things like family planning services and more knowledge about reproductive health, more knowledge and access to contraceptives, things of that nature. So those are some of the reasons that the US has a high pregnancy rate. So here, that being said, the pregnancy rate, as your book discussed as well, has been dropping, which is good. So it peaked kind of at the beginning of the 1990s, and then it's been dropping pretty steadily since then, which is a good thing. So I wanted to talk about some of the consequences of adolescent pregnancy. One of those is that for the infant themselves, they're at a higher risk for preterm and low birth weights. And if you remember from your child development class, that kind of sets you up for a lot of more negative outcomes. It's a big risk factor. So it kind of sets you up for some negative outcomes throughout life. Another thing for the adolescent parent themselves is school dropout. So not all adolescent parents drop out, but it is a fairly common occurrence. So these things also combine with other risk factors. One example could be adolescents living in a low SES community. They're a little more likely to become pregnant. So with that, that is another risk factor there that can lead to more negative outcomes. So how can we reduce adolescent pregnancy? Remember, we're talking about risk factors and protective factors. So those risk factors are those things that can potentially move our little Plinko ball towards more negative outcomes, and protective factors can either move it towards the more positive, or they can just protect it so that when those negative things happen, it doesn't necessarily push that Plinko ball towards the negative. It stays even neutral. So with that, what are some things that we can do? So one thing is better sex education and family planning, and we'll talk about this and you'll watch a couple videos about it later in the class. Access to more contraceptive methods and knowledge about how to use them can be a really big thing to help reduce adolescent pregnancy. So another is the life options approach. So you may have seen this in your schools. Maybe you had little robot babies that people took home, and those robot babies would cry. Students had to hold them, pick them up, carry them around with them, might wake them up in the night, maybe even feed them. So that was part of a class that one of the options in life that they were telling people were that, well, you could have a child, or you could plan to go to college, you could plan to work in the workforce, get a career, things like that. So giving life options can really help to see, well, if this is my goal, then a baby might make it more difficult to get to that goal. So, and another one is a lot of community involvement and support. So that kind of exosystem can be affecting that microsystem for an adolescent. And so this, as we've talked in this developmental course, other people really matter, and those connections matter. And so when there's things like nonprofits, when there's things like churches, where there's things like businesses that are involved and anxious to solve problems in the community and work with one another, that can be really supportive and a big protective factor. So for STIs, sexually transmitted infections, changing gears a little bbit here, there's not much that I want you to know beyond what is in the book. So your book does a good job at describing some different STIs, and with that also talking about some of the prevention for them and also treatments for them. So that's about all I want you to know about that content. You're not going to be heavily tested on it, but definitely review the chapter and cover that material. So an STI is an infection contracted through sexual contact. So that can be anything from vaginal intercourse to oral genital to anal genital and all other possible combinations. So some of the examples are things like HIV and AIDS, genital herpes, genital warts, gonorrhea, syphilis, chlamydia. So go ahead and review those in your chapter. I'm not going to spend more time talking about them here. So I do want to spend a little bit of time talking about rape, sexual harassment, and consent, because I think they're very relevant in our current culture and our current day and age right now. So with that, rape is the sexual intercourse with a person without their consent. So pretty simple there. If there's not consent, then it's rape. And we'll talk about consent a little bit more in detail. So for someone who has been raped, a lot of times there's an initial shock, like a feeling of disorganization, distress, maybe numbness, not knowing what to do, being confused, things like that. And that can also lead to, in the more long term, things like depression, fear, anxiety, and these kinds of states and emotions and whatnot can last for even years to come after that. Even PTSD has happened because of rape. So it's a pretty serious thing, and it's definitely something that we should take very seriously in trying to protect and help people who have been raped and been victims of sexual assault. Because we definitely want to try and minimize these kinds of things. We want to minimize the happening of rape in the first place. But when and if these things happen, we definitely want to support these people that have been raped, these victims. So with that being said, some protective factors to possibly lead to some more positive outcomes after a rape. So those things that can help before a trauma, help protect from maybe the most serious problems from the trauma, are things that are protective factors for other things in development. So things like supportive friendships, supportive relationships with parents, things like that. If there's a supportive relationship with these people, they're someone that they can go to for support, for advice, for help, and hopefully things like depression won't set in, for example. Another thing is previous psychological adjustment. So if a person was already was suffering from depression and then was raped, that would definitely be a bigger risk factor for more negative outcomes. Versus if there was no depression, no psychological maladjustment, then that's a protective factor against those things. So another is knowledge of how to report a rape and get those things taken care of from the legal side of it. So being able to find the perpetrator and have them brought to justice. So with that, the knowledge of how to report a rape can be really helpful before it happens. So then after a rape happens, then that knowledge is already there, and this victim can then go and choose to get that legal process started. But that being said, that really only helps if that context as well is supportive. So what I mean by that is essentially that the system needs to work. So if people are discouraged from reporting their rapes for any reason, if they are made to feel less than because of it, if the process is too difficult, then these are kinds of things that are not going to lead to proper reporting and working to solve the problem and getting the perpetrator prosecuted. So with that, the system needs to work, and if it's working, it can be supportive and it can be a protective factors from negative outcomes that could happen to get justice for that injustice that was done to this victim. Essentially, that can really help in that process. So shifting gears a little bit, so we're going to talk a little bit about sexual harassment. I just wanted to go over these couple quick definitions. So quid pro quo sexual harassment is kind of that giving something in return for the sexual harassment, or maybe not reporting that sexual harassment. So an example in your book was a teacher giving an A for allowing sexual advances or not reporting those things. This could happen in the workplace with a boss, for example, but it wouldn't necessarily even need to be someone in authority over another. It could also be a coworker. Another type of sexual harassment is hostile environment sexual harassment, and that is more of this severe, persistent, or pervasive sexual conduct that kind of limits a victim's daily functioning. So they're not able to do their job, they're not able to do well at school because that environment there is so hostile or toxic that they are worried all the time, and it's a negative context for them because there is this severe or persistent or pervasive sexual contact or conduct around them. So with that, I wanted to talk a little bit more about consent. So this is something that I think is very important, especially in our culture today. I found a lot of my students do not have a good understanding of consent, and so I want to make it really clear. And I think one of the clearest places I've found it is this definition or discussion of consent from Claremont McKenna College. And so I want you to go and read that. It's in the PDF for this lesson where you go to all the video links. So go to that PDF, read about consent, make sure you're understanding it clearly, what consent is, what it isn't. Just make sure you understand that there is a little video link for a funny little video equating consent to tea. So I didn't put that in this playlist, but if you want to watch that, go ahead and do it. But definitely go and read over that discussion of consent from Claremont McKenna College, and then we'll pick it back up in just a minute.